Hello and welcome to the show. You know, studies show the average couple conceives a baby in 6 months or less after they start trying. So most folks take for granted how challenging it is for some couples to start a family, which brings me to the Baker family. Danica Baker and her husband, Chadrick, had a long and challenging road to parenthood. We're talking about 5 miscarriages, 2 rounds of IVF before this little miracle came from the womb into the world. His name is Chadrick Baker II, and he is just 2 months old. And here to shine a light on IVF and infertility is board-certified OBGYN Dr. Jocelyn Slaughter, who also happens to be Danica's physician. Welcome to the show, everyone.
Hey.
Hey, Deuce, is it? I have to believe it, since everything is magic. Listen, I just want to thank you for being here to talk about what this experience was like for you, getting this baby blessing in your hands.
Yes, thank you for
Let's talk about what this was like for you when you decide, okay, we're going to have a baby. Oh, it's not going to be as easy as we thought.
Yes. We started to expand our family back in 2021, and we tried naturally, of course, you know, like all couples do. Mm-hmm. And we said we was just going to give ourselves some time because we did hear from mentors and other family members who had to conceive through IVF, mm-hmm. and they told us about it because we were waiting later in age because we was trying to get things together in our lives.
Of course.
Accomplish all the goals.
Yeah.
So we started in 2021, and we ended up having a miscarriage in 22. And then after that, we wanted to give ourselves a year before we conceived with IVF, tried with IVF.
Yeah.
But we ended up going early because the timing of everything of life, we just didn't want to wait so long. That we were blessed to conceive him in fall of last year, and we have him now.
Oh, congratulations.
Thank you.
That's quite a journey. I know that was like, for moms, we don't often get to hear what the experience is like for fathers.
Well, my experience, it was, you know, just trying to support her and going through the different cycles and the trials and tribulations and making sure she had everything she needed to have a comfortable and successful time. So I was just there to support, you know, just being that backbone.
The loss can be so devastating, one after another. Dr. Slaughter, how do you keep couples encouraged and keep them on track for trying to conceive, right?
Yes, you know, the Baker family is one of my favorite couples. When you try to do things the right way, you get married, you get your education, you want to start a family, and then you're bombarded with an issue like this, where you're having miscarriages, you're trying to get pregnant. As physicians, we try our best to keep them encouraged, and we tell them that if you're having issues, it's time to come to the doctor and allow us to help you. We can help you in so many ways with helping you with ovulation. That's one of the biggest things. And after a certain amount of time, it's time to go to the next level.
How often is sort of monitoring and helping with ovulation is the solution before you have to go the IVF route?
Well, we usually tell patients that if you've been trying for 12 months and you have not been successful, you need to come in to get help. And sometimes people can
that's with any age
That's
mother?
with any age, but as you get older, if it's been 6 months, then you need to come in to get help earlier. So over 35, if it's been 6 months, you should come in to see your doctor, and we can help you. Some people can just do over-the-counter ovulation prediction kits, and that's helpful. But if you're going month after month and you're not seeing results, you can come in earlier. There's no hard, fast rule that you can't be helped. Some people have other issues, like their spouse is about to be leaving to go out the country or military, and people need to get pregnant quickly.
All the things that happen. Danica, I know for you, as you do what moms do, multitask, marvelously so, I may add. I know PCOS was also an issue. Endometriosis was also an issue. Let's talk about the impact that had in your path to motherhood?
So PCOS, I discovered that when I was in college. I kept having heavy periods, and then that's when they diagnosed me with PCOS, along with like the acne, the chin hair, all of those hormonal. I kept gaining weight, and that's when they diagnosed me with that. But
I want to pause you just right there. PCOS stands for again?
Polycystic ovarian syndrome, and it's basically when women's hormone levels are sometimes abnormal, and it causes them not to ovulate every month, which can reduce your chance of becoming pregnant. pregnant, and they can have, like she said, acne, facial hair, and irregular periods.
Right. And then endometriosis, what was that like for you and the impact that had?
So I continued to have heavy periods once I relocated here in Georgia, and that's when my doctor was like, okay, I think it's time for us to figure out if you had endometriosis. At the time to find out, they had to have a surgery, and they did that through laparoscopic, and they found out that I did have endometriosis through the scar tissue through that surgery. So,
Chadrick, for you, what is your advice to other fathers out there, other husbands out there who are trying to be supportive, but PCOS, endometriosis, all of these things are new to the mom going through it, certainly for the husbands and fathers. What is your advice to keeping parents encouraged?
I would just say have a great support group. The people around you to have encouragement throughout the whole journey. We got a real good support group with the church we go to, and just other people, just like Dr. Slaughter, just helping out when it's needed. So I mean, the biggest thing is the support group, to make sure you have what you need and talk to other people. Don't be afraid to express your feelings to other people around you that may have went through the same thing or may not went through the same thing, but has the ultimate goal and been through things. So.
Right. I know they're hard nights. Oh, yeah. Lots of tears. Your reminder just to folks that this is what can come at the end of this journey.
yes, just stay encouraged, trust God, most importantly, get strong in your faith. Again, like my husband said, have a great support group, do lots of research, and don't be too shy to advocate for yourself and to educate yourself.
Wonderful, wonderful advice. Thank you so much. You are such a good baby, Deuce. I love it. Thank you so much. All right, listen, when we return, you'll hear why Janicia and Octavius opted for an at-home delivery instead of going to the hospital. Plus, you will meet a team of medical professionals who specialize in advocating for mothers and postpartum care. Stay with us. The conversation continues right after the break.